I'm Dr Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney. Welcome to this video on how to fix problems with Intacs. So for those of you who don't know, Intacs are this little plastic rod that's inserted into the front of the eye to change the shape. And when it's inserted into the front of the eye, the cornea, it changes the power of the cornea and it changes your prescription. So you go from short-sighted to a bit more long-sighted, etc. And it has some applications in those areas. It's found an application in keratoconus, but it can cause a whole range of problems. The purpose of this video is not to discuss the problems, but to show how I deal with the problems from Intacs. Now, for those of you who don't know much about Intacs, or don't know my opinions on them, here is a young lady who's had Intacs in both eyes. She had cross-linking and then Intacs, and the second she had them in, she said she couldn't see. And so what she'd been doing is put pilocarpine in her eyes to shrink the pupil down even more so she could actually see. She had too much distortion and she went on and on with this for ages, and after a couple of years she'd had enough. She was using pilocarpine drops 4 times a day, and she just came to me and said, "Can you remove them?" Interesting, I said to her, "I saw you 10 years ago, told you not to do anything." Well, I didn't quite say that. But she'd been talked into it. Had made no difference to her vision. That's one eye, and the next eye is there. And you can see it. Interesting how around the Intacs, this has only been in for a couple of years, you can see the white deposits and they actually get worse over time. This is a very small Intac segment right around the pupil, and you've got to wonder what happens as that white deposit increases. Anyway, so here it is. This is what happens at surgery. What happens is I take you to surgery, and this incisions are made by lasers. It's this brilliant laser technique. The laser is amazing for cornea, and it makes a tiny little incision at the top. Now I've got to open it up, and you'll see here that I spend a bit of time trying to open up the incision. In fact, it takes quite significant time. You can see the little white line that's there. That was there from the laser surgery and from the healing. Everything in the body heals by scar. It doesn't matter how miraculous we like to tell you things are, there still is a scar, and with a microstep, I can see it. You can see it right now. So there's a scar. But what's interesting is just how much effort I have to put to open this wound up. The cornea does heal, but it takes a long time, several years. I tell my transplant patients 3 years. So here it is, and I've got a little hook in there because these little rings have a hook in them. Now, because they're plastic, they're a rigid polymethyl methacrylate substance, the body doesn't actually grow into it, doesn't attach it. So what's intriguing is they slide in, and as you'll see, they slide out. And that makes them relatively painless to get out. It's a bit of an annoying thing to have to do this, but believe it or not, it settles down, and you will see that in a minute. So I get that little hook in there and try to hook it out, and you know, the thing slides, it wants to keep moving. So the more you push, you can actually keep pushing it down the hole, which is real pain. So you've got to be a bit careful, and you'll see it takes a few goes. I'm holding the eye, and there it is, sticking that little hook in there to try and get it out. It's a bit of a turn of the wrist, and then bang, I've got it out, and I can just hold it. Now watch it just slide out. Here it goes. Out she goes. Out comes the hook, change forceps, and there it is. And it's a little trophy for the patient. So I put it in a container and say, there you go, put that on your mantelpiece, and you can have a look at it every now and again, make some jewelry out of it, whatever you want to do. But certainly don't put it back into your eye. There it is. So you can see there's still a ring appearance in the cornea. That's the space inside the cornea. All right. So after surgery, you can see there's a little shadow to one side. That's that haze that was there before surgery. And on the other side, you'll see that haze again. There's even got the little hole there, where the manipulation hole. There's an outline of it there because it's been etched into the structure of the cornea. Will it go? Don't know. What did she say? She said she no longer needs the drops. The distortion has gone. However, you have to wonder if this is going to have any long-term effects. I don't think it will be significant at all. But she's back after all that treatment to square one. So she said, I have to wear glasses to drive. She doesn't want to wear contacts, and I'm reluctant to offer her any other treatment. So that's Intacs. Not a huge fan of it. There's other things that's called Kera rings, all different trade names for these intracorneal ring segments. ICRS is what they're actually known as. I removed them, never put them in, never referred anyone to have them done. So I hope that all makes sense. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery, and thanks for watching.